All right, welcome back to the deep dive. We are so glad you could join us again.
Yes, welcome back, everyone.
Today, we're going to go deep, really deep,
Uh-huh.
on a topic that is absolutely exploding in the world of healthcare,
Right.
and that is integrated care.
Yeah.
Um, and
And I think a lot of folks are starting to hear this term bandied about.
yes, very much so.
And what we really want to do in this deep dive is
Hmm.
to give everyone
Absolutely.
a clear picture, as clear a picture as we can, of what integrated care is, the different models of integrated care,
Right, right.
what the research says about it, the sort of clinical techniques and skills
Absolutely.
that are utilized in integrated care.
Right, right.
And the reasons why this is
Hmm.
such a sea change, such a big shift
Yeah,
in the thinking about
yeah,
healthcare.
absolutely. It really is.
And we have just a ton of material that we're going to try to synthesize.
For everybody today, we've got journal articles, we've got training materials,
Yes.
we've got all kinds
We've
of
got it all. We've got it all. Yes.
good stuff. So,
Yeah.
um,
Let's dive in.
let's just jump right in. And I guess to start with, just for folks that
Yeah.
maybe haven't heard this term before
Mm-hmm.
or aren't quite clear what it means,
Mhm.
what is integrated care? What is it?
Yeah. So, I mean, really at its heart,
Uh-huh.
it's about trying to increase access to
Mm.
mental health services and do that by really bringing mental health care into
Mm-hmm.
the kind of everyday places where people go to get their
Right.
healthcare needs met.
Right.
Imagine, your primary care physician, your doctor's office, that kind of thing.
Right.
Rather than having, these two separate worlds of
Mm.
physical health and mental health, really the idea of integrated care is to kind of bring them together and think
Yeah.
more holistically about
Right.
a person's well-being.
Right. It's that mind-body connection.
Exactly, exactly. Mind-body connection.
So there's a spectrum, though, right?
Yes, yes, absolutely. There is a spectrum. So it's not just one thing. It's not like,
Yeah.
oh, we're doing integrated care and it's all the same.
Yeah, yeah.
There are different levels of integration. So on one end of the spectrum, you might have like coordinated care.
Okay.
And this is where like maybe your primary care physician and your therapist are talking to each other, sharing notes, maybe making referrals, but they're still in different locations. You're still going to two different places
Yeah.
to get those services.
Right, right.
And then a step up from that would be like co-located care.
Okay.
And so this is where like you might have a mental health professional like a therapist or counselor actually
Yeah.
working in the same clinic.
As your family doctor.
Got it.
And that obviously makes it a lot easier to make referrals, to have those
Yeah.
quick consults, just kind of pop your head in the office and
Right.
and have a quick chat with
Yep.
the mental health provider.
Right.
But I guess the real aim is to move towards fully integrated care.
Okay.
And this is where mental and physical health are really woven together in everything from how you're assessed to how your treatment is planned,
Okay.
to the follow-up, and really all of that is kind of integrated
And
to
right.
one seamless
Got it.
system.
So even though they're in the same building, it doesn't necessarily mean it's
Yeah,
fully integrated.
Exactly. It's really about, that level of communication, the level of collaboration, and the level
Yeah.
at which those services are actually woven together.
Oh, got it. Okay.
So even if you have a mental health provider in the
Same clinic, if they're kind of operating in their own silo,
Right,
that's not truly integrated care.
not truly,
Yeah.
not truly.
Yeah.
Okay.
That really helps clarify that because
Yeah.
I think I had a somewhat basic understanding that, well, if they're in the same place, then it's integrated.
Right, right.
But it's really much,
Yeah,
much
yeah.
deeper than that.
Deeper than that. Yeah, absolutely. Sure.
And you mentioned different
Yeah.
models of integrated care. So,
Yeah.
are there specific models?
Yes, there are. So within these different levels, there are different models.
Okay.
So for example, you might have targeted integration.
Okay.
And this is where they're really focusing on specific groups of people
Okay.
or specific health issues.
Hmm.
So, for example, maybe they're
Mm.
integrating mental health services for people with diabetes
Mm-hmm.
or for pregnant women or,
Right.
for older adults.
It's really targeted towards a particular population or a particular issue.
Right, right.
Then you have non-targeted integration.
Okay.
And this is kind of more of a broader approach where mental health support is available to pretty much anyone
Right.
who's using the primary care setting.
Got it.
So, you come in for a checkup, and if you're experiencing any mental health concerns, they're there to address that as well.
Right. Okay.
And then there's a less common model called reverse integration.
Okay.
And this is where primary care services are actually
Interesting.
brought into a mental health clinic.
Okay.
So it's kind of the opposite of what we
Yeah.
typically think of.
So
Yeah.
you're going to your therapist.
You're going to your therapist, and
Right.
maybe they have a nurse practitioner there who can
Right.
check your blood pressure
Is
and,
it like-
do some basic medical screenings.
Got it. Wow. Okay. So there's all
Yeah.
kinds of interesting layers to this. And this is something that's also showing up in the training of mental health
Yes,
professionals.
very
now.
much so.
Mm.
So, if you look at, for example, the 2024 KCREP standards,
Right.
was the Council for Accreditation of Counseling and
Yeah.
Related Educational Programs, which is kind of the
Yeah.
the main body that accredits counseling programs.
Mm-hmm.
They specifically include integrated behavioral health care
Right.
as a key part of
Yeah.
the spectrum of care.
Okay.
So they talk about it along with your typical primary care outpatient inpatient
Yeah.
settings. It's really becoming a core part of how
Yeah.
we're training
Yeah.
future mental health professionals.
Okay. So that really clarifies
Yeah.
what it is. But why? What's the point? Why are we doing this? Why is it important?
Yeah, the why is huge, and it's really backed up by a lot of good research.
Okay.
One of the biggest reasons is just improving access to care.
Okay.
Especially for children, for example.
Right.
This is it's not just about having more therapists available, but it's also about reducing stigma, making it easier for parents to seek help for their children.
Right.
Catching those issues earlier
Yeah.
when interventions can be most effective.
Yeah.
We also see, in the research, we see increased client satisfaction.
Okay.
People tend to be more satisfied with their overall healthcare experience when it feels more joined up, when it feels like their needs are being addressed in a more
Yeah.
holistic way.
Right. You're not getting, shuffled around to 10 different places to get 10 different things taken care of.
Exactly. Less running around, less fragmentation of care.
Yeah. And so the research shows
Yeah.
the client outcomes are actually better.
Yeah. Yes. So it's not just about access and satisfaction. It's actually about better outcomes. We see improved outcomes for a wide range of conditions.
Okay.
Increased quality of life for people.
Wow.
Some studies have even found that integrated care can decrease length of hospital stay for certain conditions.
That's a really measurable.
It is. It's not just, people feel better.
Yeah.
It's actually making a difference in those measurable outcomes.
And is there any data on whether it reduces healthcare utilization overall,
Yes.
which would theoretically reduce costs?
So there's evidence that suggests it can lead to reduced healthcare utilization overall and lower costs.
Okay.
So for instance, there's a study that showed a decrease in depression scores for patients in integrated care compared to those receiving their usual
treatment. We've also seen significant improvements in quality of life for people with severe and persistent mental illness. So often,
right.
what we call SPMI.
Right. So it's not just folks that are, mildly anxious or kind of stressed out.
Exactly. It's really across the spectrum of mental health concerns.
Yeah. Okay.
And for individuals, for example, struggling with major depression, integrated care has been linked to increased treatment adherence.
Okay.
So people are more likely to stick with their treatment and to see better long-term improvement in their depression.
That's great.
And it also creates opportunities for things like, effective trauma screening in primary care settings, which might not happen otherwise.
Yeah, that makes a lot of sense.
Yeah.
These are all really
Yeah.
Great benefits. Do you have any examples of like real world
situations where this is working?
Absolutely. There's an interesting example
Okay.
from Gouge and Paloha back in 2013.
Okay.
And they found that having a behavioral health intern
Okay.
in a primary care office for just 1 day a week actually
Yeah.
increased the clinic's revenue.
Wait a minute. How does that happen?
Because the behavioral health provider could address those mental health concerns
Right.
during the patient's visit, it freed up the MD's time
Okay.
to see more patients with purely medical needs.
Okay.
So it's a real, like, concrete example of
Right.
how this can actually be both clinically effective and financially beneficial.
That makes a lot of sense. Yeah, that's a really good example.
It is. It is. It's one of those, like, concise pieces of information that just kind of sticks with you.
Right, right. It just kind of
Yeah.
clicks. Okay. So we know what it is,
Mm.
and we know why it's beneficial, but how? What are the techniques, the skills, the nuts and bolts of how do you actually do this?
So the how really involves a certain kind of mindset and a set of clinical skills that are really geared towards integrated care.
Okay.
One foundational technique that's often taught is called STOP. STOP. And it stands for stop, take a breath, observe, proceed.
Okay.
And it's a really simple but powerful tool for just staying present and responding thoughtfully, especially in those kind of fast-paced environments of integrated care.
Yeah, I can imagine that. That would be helpful in a lot of situations.
Yeah, in a lot of high pressure situations.
Yeah. But what about some of the specific clinical skills that are used?
So, think about the kinds of interactions a mental health provider might have in that primary care setting. We're talking about things like the warm exchange.
Okay.
That quick building rapport with someone, doing a very brief assessment, really just kind of getting the gist of what their concerns are, using things like motivational interviewing to help them think about making changes.
Right.
Approaches like solution-focused therapy and positive psychology are also really valuable in those shorter interactions. And then, of course, you have the quality assurance piece, making sure the care you're providing is actually working, is appropriate, all of that.
Right.
So building on that foundation of mindful presence from the STAP-P technique, there's really a whole range of clinical skills that you need in the fast-paced world of integrated care.
And I would imagine that a huge part of this is also collaborating, with the
consultation
with the physicians and
like medical professionals, huge
nurses and everyone on the healthcare team.
Absolutely, and even things like addressing pain management from a psychological perspective become really important.
Okay,
and all of these kind of fit together in what's called the comprehensive healthcare integration framework.
Tell me about that framework.
So this framework really lays out all the key pieces of effective integrated care. So it includes things like screening and follow-up for different health risks. So, we're talking about things like, suicidal ideation risk, opioid misuse risk, trauma history, all of that. It emphasizes using evidence-based treatment protocols, thinking about, when medication might be appropriate, that kind of thing. Longitudinal clinical monitoring is really crucial. So that's just tracking how a patient is doing over time. It talks about using culturally appropriate tools for patient activation, so really helping patients be active participants in their own care. Really strong, collaboration and information sharing amongst the whole care team. So, obviously being mindful of patient privacy, but really making sure everyone's on the same page. And really importantly, it talks about ongoing training. Making sure that everyone involved in delivering integrated care is up to date on their skills. And then looking at, metrics for monitoring effectiveness. So how do we know this is actually working? It also talks about, linking to social determinants of health. So, thinking about, someone's housing situation, their employment, their access to food, all of that. And finally, it also talks about sustainable billing. How do we make sure that these programs can continue to operate?
Keep the lights on.
Keep the lights on.
Yeah. So, I mean, it's really a holistic, patient-focused kind of a...
Holistic, patient-focused, system, really.
Yeah. That's really interesting.
Mm-hmm.
Um, one of the things that I think is interesting about integrated care is that it seems to change how we think about like what counts as evidence. What's
Oh, that's a
evidence-based
pretty
practice?
critical point, actually.
Yeah.
Yeah.
Integrated care often leads more towards what we call practice-based evidence, or PBE,
Mm-hmm.
compared to a strict reliance on what we typically think of as
Yeah.
evidence-based practice,
Mm-hmm.
or EBP. Right, right, right. So explain, what's the difference?
So yeah, so EBP often involves, taking standardized
Right.
treatments that have been shown to be effective in large research studies and then kind of applying those in the clinic.
Right.
PBE is much more about what's actually working
Okay.
for this specific individual in this specific situation.
Right.
So it involves continuously gathering feedback from the client.
Okay.
What are your goals? How do you feel about this approach? How's the relationship with your provider?
Right.
It's a much more collaborative
Right.
approach.
It's not just, here's the protocol, this is what we're doing.
Exactly.
Yeah.
It's much less of that traditional top-down
Right.
medical model.
Yeah, yeah.
And it really values the client's own
Right.
wisdom and experience.
So it's saying what works for this individual in this specific situation, as opposed to what worked for a large.
So while EBP, might suggest, okay, for anxiety, we use this particular therapy protocol, based on these large studies. PBE, integrated care, might be, okay, well, how helpful was that for you? What worked for you? What didn't work for you?
Yeah, right.
And really tailoring it to the individual, even if it deviates slightly from that standard protocol.
That makes a lot of sense.
Yeah.
There's a quote from a revised Hippocratic Oath.
Oh, interesting.
I don't know if you've ever seen this, but it says, there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug.
Yes.
And it
really speaks to that human-centered approach.
Yeah, yeah. It's about the whole person.
Exactly.
It's not just about the symptom.
So it's just about the symptoms, yeah.
So who is this person?
Mm-hmm.
Right. Is the integrated care provider?
Yeah.
What are their skills, their mindset, their approach?
So the integrated care provider often embodies what we call the gather principle.
Gather principles.
Gather principles.
Yeah.
So they need to be a generalist.
Okay.
So comfortable addressing a wide range of issues.
Okay.
Mental health issues, physical health issues.
Right.
They need to be accessible.
Okay.
So easy for clients, easy for other members of the healthcare team to connect with.
Okay.
They are very much team-based.
Okay.
So, working closely with those doctors, nurses, and support staff.
Yeah.
They often handle a high volume of brief interactions.
Right.
Throughout the day.
Yeah, yeah.
They act as an educator.
Okay.
So, providing information, resources, both to clients and to the team. And they take a very routine approach. This is a regular embedded part of the practice's workflow.
Gathered. That's a good
way.
Mnemonic device.
Mnemonic, to kind of remember what those key principles are.
Okay, so what else? What other?
What other qualities are really important for someone in this role? Strong listening skills are absolutely essential.
Right.
As is the ability to quickly build rapport with everyone they interact with.
Right.
Not just the clients, but also the doctors, the nurses, the admin staff, everybody.
Yeah.
Being able to, understand different personality styles and adapt how you communicate is really crucial.
Okay.
And then a really fundamental aspect is what we call whole person curiosity.
Whole person curiosity. What does that mean?
So it's about genuinely wanting to understand how a client's mental and physical well-being are connected.
Okay. Okay.
So it's about asking open-ended questions.
Right.
Like what parts of your experience haven't we talked about yet?
Yeah.
What does being healthy mean to you?
Right, right.
It's also about, understanding what's most important to the client, which might be different from what the healthcare provider initially focuses on.
Right, right.
Exploring both personal and systemic factors that might be impacting their progress.
Okay.
And this curiosity also extends to the clinicians themselves, encouraging them to really think about their own
Right, right.
assumptions and potential blind spots.
Okay, okay.
Yeah.
So it's really trying to see the individual
See the whole person in the
and
context. Yeah.
context. Absolutely.
Right, right. And a huge part of integrated care is the interprofessional collaboration.
Yes.
Absolutely.